the amount of patients that I have where the primary disorder, let's say, is anxiety, but the secondary disorder is some sort of chronic pain for whatever the cause is. And it's so common to find that you target the anxiety, but their chronic pain is also managed as well. And that's very likely to be because of essentially the extent of the endocannabinoid system. It is basically all over your body.
Hi, everyone, and welcome back to Harmonia Podcast. We are joined here today by Dr. Searle, who's going to go over medical cannabis as a medication. But before we go into that, Dr. Searle, would you like to introduce yourself?
Sure. Hi, everybody. My name's Dr. Luisa Searle. I'm a consultant psychiatrist. I guess I've been working in medical cannabis now for about the last 3 years, but my background is actually in addictions. And I think actually the two specialties are well placed to work together because I think I can understand better than other doctors perhaps about the potential risks of dependence with medical cannabis, but also the fantastic benefits of it also.
Yep, that's amazing. And actually, you touched on a key area there, which is around addiction and psychological dependency. So I think it's very important, actually, that this is something that I suppose the medical cannabis community in the UK recognize and sort of look into. But while we're discussing the actual medication itself, what can you tell us about medical cannabis? I think there are a lot of people that have a lot of questions around the medication itself, how it works, and stuff like that. Um, yeah, I'm just going to hand it off to you.
So since 2018, the law was changed, and essentially it reclassified cannabis from a Schedule One, which is just illegal, essentially, like other illicit substances like heroin, crack, cocaine, these kinds of things, and it was put into a second category that allowed for medical use, and this was. A large part of it was driven by parents, essentially parents of children um, who had, intractable epilepsy, very, very ill, in and out of hospital all the time, who had discovered medical cannabis as part of their search to try to help their children. So these were the real big drivers of this change. And thank goodness for them, essentially, because so many other patients have been able to benefit as a result. So medical cannabis was reclassified, so we can now study it more easily and we can now prescribe it. There are a few conditions, I would say, on prescribing. So not everybody can prescribe medical cannabis. You have to be on the GMC specialist register. So that usually means that you're a consultant. So you've got a consultant status and you're registered with the medical council. If that situation is satisfied, then you can approach a specialist who prescribes medical cannabis, and they can see if you're eligible. And there are a couple of eligibility criteria that you need to satisfy in order to access it. And this is mainly because, as yet, medical cannabis is not licensed. So what that means is it doesn't have the same strength of research behind it that other licensed medications have. And when you break that down, essentially what that means is there is a certain type of robust research that needs to be completed, usually randomized controlled trial, something like that, of that sort of magnitude. And this then basically, what that does is that proves, one, that the medication works versus a placebo or versus an already established medication. It establishes the risk profile, and it also establishes the indications. So who can be prescribed this medication and under what circumstances. And with medical cannabis, while we have lots of what we call real world evidence, and there are studies emerging that want to assess its efficacy, they don't quite reach the level of this like randomized controlled trial. So we know it works because we've got lots of patient testimonies essentially and studies involving patients, and also smaller studies that researchers are trying to sort of like isolate the compounds in it that are efficacious, but it doesn't quite reach that threshold. So what that means is we have to be a little bit more thoughtful, I guess, about who we prescribe it to, and just have a little bit more of an examination about whether it's appropriate. in that circumstance. And essentially, the biggest factor that we look at is, has a person already tried and exhausted conventional medication? Because I think it's a hard argument to suggest a medication that's unlicensed, that doesn't have that same body of research behind it, to say, try this as a first line. It's better to try licensed medication with established risk profiles, etc., first. However, lots of patients have already usually tried at least two medications, especially things like depression. Often there's this history of multiple medications that have been tried. Some have not been tolerated, some have been tried, and the results have been somewhat like limp, let's say, side effects, and for not really great outcomes. So in these types of circumstances, patients can think about, is medical cannabis the right next step for me? And then we have to consider other things like risk factors that are actually in the patient themselves. So things like certain mental health disorders would not be appropriate for medical cannabis because of the potential risks of medical cannabis making those disorders worse. And it's typically psychotic disorders. So these are disorders where a patient can have periods of being like detached from reality. That's the best way to describe it. They can experience hallucinations in the visual domain, in the domain of hearing. They can experience all sorts of odd sort of thoughts and feelings about others, about themselves, that are not based in like reality. They are what we call psychotic. So these are disorders like schizophrenia, certain types of bipolar disorders, especially those where people become manic and then become psychotic. There are other types of psychotic disorders as well that don't necessarily fit into those two categories. Even if you've had a transient period of psychosis, so for whatever reason something happened to you and you experienced visual hallucinations, then unfortunately these types of things would exclude you. We also have to be a little bit careful about people who have a family history of such disorders. However, I personally feel like it's a bit discriminatory to exclude somebody on the basis of, there's a person in your family that has this disorder. So me personally, I'm willing to work with somebody. I think it depends on the degree of the family history. If you've got mother, father, sisters, brothers, all with, let's say, schizophrenia, then it's very unlikely that I would risk prescribing it for you. But if it's just, say, one parent or a brother or a sister or a grandmother, then I think we can consider that, and I will talk to you about, the potential risks. And I guess when we're thinking about medical cannabis and the risks of developing these types of disorders, it's still under investigation. So what we don't know is, does medical cannabis cause directly these types of disorders, these types of psychotic illnesses, or does it bring it out earlier in somebody who had already developed this kind of thing? And that's where the big question mark is, and that's what a lot of researchers are trying to establish. Or a third option, do people who develop these types of disorders naturally gravitate towards substances like cannabis because it's calming, because it helps them in some way? So it's picking out which of those three, and there are probably more options as well, is potentially the consequence of using cannabis. So because we don't know yet, we sort of err on the side of caution. It's also more risky under the age of 25 to be using cannabis because there's a lot of things going on with your brain, essentially. Between about 16 and 25, let's call it remodeling. New connections are being made, old ones are being severed. There's a lot going on up there. So there's a concern that medical cannabis could somehow interfere with what's going on at that particular time. And then that, predisposes you to some type of psychotic disorder or other mental health issues. So there's a lot of counselling that goes on beforehand, especially if somebody has those types of risk factors, to make sure that they're comfortable with it as well. If you don't have any of those types of risk factors, then we're looking at kind of like softer risk factors, if you like. There are other ones in mental health, I guess, that are also sort of like, would cause you to sort of not qualify. And those are things like, unfortunately, if you've been suicidal, it depends to the degree which you've been suicidal. If you've made a suicide attempt in the last year or so, then it's probably not the best time to start medical cannabis, because again, one of the risks of it is that it can worsen your mood. It can make anxiety worse, and if you have attempted, on your life in the last year, you're very much still in quite a vulnerable state. So again, it's not a good idea to prescribe you something unlicensed like that, because obviously we don't want to make your mental health worse. So you would need a period of stability first. Now, thoughts of suicide are very common in things like depression. So just having thoughts of suicide wouldn't necessarily prevent you from having like medical cannabis. But again, it's just something that we have to kind of take into consideration. And there's always this kind of like weighing up, I guess, of the risks. Like, would medical cannabis benefit you to the point where your quality of life, etc., is improved so much that it's worth taking, a risk if there are any risk factors there? And often it's sort of like trying to weigh up this, pros and cons, if you like, and hopefully the pros will come out on top, and the risk will be something that can be is either minimal or can be managed quite easily. So those are just a few examples of like mental health reasons. Then there are some physical health reasons as well why you might be excluded from medical cannabis. If you've got an unstable heart condition is a prime example, or a recent history of a stroke. And this is because of the direct effects of medical cannabis on your vascular system, essentially. And it can put strain on your heart. It can disrupt your blood pressure, which is a risk factor for strokes. So again, we'd need to like examine exactly what that risk was. So let's say you've tried enough medication, you've tried at least two, let's say, antidepressants, you don't have any of the risk factors, or the risks are manageable, then we can go on to consider you for medical cannabis. And this is what kind of happens in this sort of like triage process. So before you've even seen somebody like me, there should be this like screening process so that you don't waste your time essentially having an assessment and then it turns out you don't qualify. So once that's done, you then come and see somebody like me, and hopefully a good clinician will go through the particular symptoms that you're struggling with, what you want to try and treat with medical cannabis. I think it's really important to be clear about what's the intention, because it's an unlicensed medication. We're kind of pioneers really in this field, and patients are also pioneers in this field in that they are, the willing test subjects, if you like, for this unlicensed meds. So we've got to be clear about what's the intention of this medication. And if we don't achieve that with the medication, then it's time to think about stopping it, because what's the point if we're not making you better, if we're not improving your quality of life? So we'll go through that process. We'll check your history, we'll check your medical history, etc. And then we'll get on to the business of prescribing, let's say. So we'll make sure there's no interactions with current medication that you're on, because there are some that you need to consider. It's often to do with additive effects of cognitive impairment. So cognitive impairment being things like feeling sedated, feeling less alert. Sometimes it can make you more clumsy, you can feel dizzy, it can affect your judgment, your ability to remember things and recall information. So there's lots of different types of cognitive impairment that can occur with medical cannabis. And when combined with other medication that also has a psychoactive effect, those two things can combine and just essentially cause increased cognitive impairment. So we need to think about interactions. We also need to think about what formulation of the medication do you want to take it in? Now, often patients have some experience of black market cannabis. So a lot of patients want to think about the flower. So that's the form that you will use, probably most patients are most familiar with. And you have to grind it and you have to vaporize it to get the active ingredients out of the plant. And I think that's a key thing. Like, vaporizing is key. All medical cannabis has to be vaped. You cannot smoke it. It's illegal actually to smoke it. And that's for a very good reason, because the act of combustion releases carcinogens, and no doctor wants to prescribe you something that essentially could cause you harm. So vaping is the optimal, because it doesn't actually combust the medication. It heats it to the point where it activates the THC in it so that you as a person can get the benefits from it. in that heating process as well, at different temperatures, different compounds from the plant also get released, that we're still kind of like unpicking what's the benefit of these different compounds, because THC alone doesn't explain it. Because I'm sure, as patients, what a lot of people well know, different types of cannabis have different effects. And so something that's useful just before bed is not necessarily that useful in the daytime, because you don't want to be sedated, you want to be able to do your work. And similarly, something that's suitable for the daytime that gives more energy and motivation and focus is not good at bedtime when you're trying to sleep. So these two, I guess, times of delivery, you can have a plant that has exactly the same THC level, but they have completely like opposing effects. And why is that? And that's what we're still kind of like unraveling and unpicking. And I think that terpenes give us clues. So I think a lot of things in nature, the smell of things gives you a clue as to whether it's good for you, bad for you. You think about things that are rotting, for example, you smell it, it gives you an immediate clue, stay away from that substance. Whereas something that's more pleasant smelling, like a citrus plant, say, for example, kind of draws you to it. You want to sort of like find out more about it because it's a pleasant and inviting smell. So I think that the terpenes give us clues, but I don't think it's the whole answer, but I think it's a starting point in terms of how to decide which type of medical cannabis might be suitable for you. And so,
So sorry for interrupting. For somebody who is not quite familiar what terpenes mean, would you be able to just go into it a little bit?
oh, sorry, yeah. So terpenes essentially are compounds that give things, your organic material, flowers, plants, fruits, etc., gives them their smell. They're quite volatile. A lot of them are quite volatile. They are thought to have different properties. One that people will be very familiar with is limonene. That is found in lemons, limes, and gives that citrusy, lovely smell. And there are various different terpenes that have different names, that have different scents, essentially. And they are present in different percentages in the cannabis plant. And so this is why we sort of look at them to try to determine what their effects might be, because there's some emergent research that certain terpenes have different properties, like anti-inflammatory properties, for example, or antibacterial properties. So we use those to try to guide us, because there's quite a lot of different types of medical cannabis available. So how do we decide like what's suitable for a patient and what isn't? Um, the other thing we'll also look at is THC level. Somebody who uses black market cannabis very frequently, or somebody who is completely naive, will definitely lower the THC level, right down. Whereas somebody who's a bit more experienced, we can be a little bit more confident to give them something more average, THC level. Still won't give them the highest straight off the bat, because you wouldn't start somebody on a medication at the highest dose. So why would you start somebody on medical cannabis at the highest dose, especially as the risks increase as the THC level increases? So you start somebody, at a much more moderate dosage and see what the effects are. And also, what's the purpose of giving somebody a very high THC level if one at much more average levels can do the same job, essentially? Like, there isn't a good argument for that. So it's a good idea to sort of start lower and build up. So that's essentially flower in a nutshell. I guess some of the main differences with the flower are the onset of action. So it starts working within 5 or 10 minutes of inhaling it. You reach peak plasma levels maybe 15 to 30 minutes after you've started. So, really within half an hour, you can start to assess whether a flower is helpful to you or not. And then average duration of action is about 1 to 2 hours. I would say that the disadvantages are that the THC levels go up much more quickly when you inhale it. So that's sort of a situation where you're much more likely to get side effects like straight away, because your THC levels kind of like shoot up. And if you're going to experience any like fast heart rate or anxiety, it's going to happen like very, very quickly. So you have to be a bit careful, I think, when you're thinking about prescribing something for inhalation. But I guess the advantage of that quick onset of action and quick rise in THC levels is that if you are, for example, experiencing a panic attack, you want something that works quickly. You don't want to be trying to wait around for an hour for it to work to help, calm you and bring you back down. But then I guess going back to, potentially why something that's fast acting is not so good, and that links to the first comments that we made about dependence. Psychological dependence is much more likely to occur in a short acting medication. Any short acting medication, the brain immediately sets up a wiring system. I feel like this, I take this, I feel better. And that can form a really like strong association in your brain very, very quickly. And that essentially is part of what leads to like psychological and physiological dependence. So you have to kind of like bear that in mind. Are you able to deal with that potential risk? And there are ways I think that we can try to manage it. So one way that I try to manage it is say to my patients, try and have 1 or 2 days off per week if you can, where you don't use the medication at all. And this is really about you exercising control over the medication. This is about you saying, at any moment, if I want to put this down and walk away from it, I can. If I've got something I need to do where, it's not appropriate for me to take my medication, maybe I've got to go into the hospital or I'm visiting somebody where I feel uncomfortable, to use my medical cannabis. It's important that you have that ability to be able to put it down whenever you want to and pick it up again if you want to, but really to be able to put it down whenever you want to. I never want my patients to be under control of their medication. I always want them to be under control of it. So it's just something to sort of like consider. If you can't do 1 or 2 days per week, then maybe every 2 or 3 months, take a treatment break, take a longer treatment break. So give yourself about 2 weeks off from the medication. And then this way you can essentially, what happens in that time is that your receptors normalize. So the receptors that pick up on the THC, on the CBD, they kind of normalize in that 2 week period. So by the end of it, your tolerance should have come down. So it should mean that you need a lot less than you did prior to the treatment break to have the same effects, which can be good for a whole host of reasons. Reduces risk, better for your pocket in general, because unfortunately medical cannabis is still private at the moment, so patients have got to pay for their medication. And again, it's just about exercising control. So once we've sort of like talked about prescribing flower, if that's not for you, you can also consider other formulations. So it usually comes in liquid form. So it still has the active ingredients, it has the THC, and it often has varying amounts of CBD in there also, which can be really beneficial because CBD is sort of like, I guess, like the brother compound, if you like, of THC. They kind of have opposite effects. So CBD doesn't have any psychoactive effect, so you don't feel a high, as it were, but it's thought to have anti-anxiety properties, calming properties, very good for things like inflammation. So it can be a good addition to a plant or to a formulation to just sort of like balance out the effects of THC. And it can sometimes help with side effects from THC as well. It can just like soften them and just make them less like intense. So you can have varying amounts of CBD, and it will, depending on your presentation, what you're dealing with, the doctor will decide on, which concentration would be the best. Usually the onset of duration of action is between 1 and 2 hours, can be quick, can be longer. It's a little bit more unpredictable in terms of its onset of action, which some patients can find quite challenging. But I think it's just a case of trialing the medication and trying to work out what way works best for you when you take an oral preparation. It takes a little bit more fiddling, if you like, but once you've cracked it, I think it's superior personally to the flower. Reduced risks of dependence much, much, much more so, just because the onset of action is much, much slower. You can change the doses much more easily because obviously it's a set amount of THC in a set amount of number of mils of the liquid, and so therefore, if you take a portion out of it in a syringe, you can work out exactly how much THC you're getting. And then the duration of action is much longer as well. So, you can take a dose, let's say, in the morning, and for some, it can last all day. Like, the effects of it can be beneficial all day, or at least half the day. So there's real benefit. It's much more discreet as well. So there's no smell, there's no faffing around with grinding and putting it in your vape. So I think that that's particularly good for people who might have issues, say manipulating things with their hands. If you've got arthritis in your hands, I think it can be quite difficult to try to grind the flower, manipulate it in the vape, etc., and put it in often in these very small little pods. So oils, it's just much more simple. You just open the bottle, and take some out with a syringe. So I think there are advantages to it, and I quite like the oils, and I actually quite like patients to have a combination of the two, actually, because I think you get much more consistent treatment, and just use the flower for kind of exacerbations of your illness, things like panic attacks, or just if you're having a really crappy day, mood and anxiety flow like water. So some days are better than others. So I think there are advantages of the oils, and certainly for naive patients who don't have any experience of medical cannabis, the oils can be a great way to start off. Again, because the results are much more predictable, and the dosages are much more predictable. And if at a later point you want to graduate to flower, you can do. And there are some nice what we call balanced flowers that are available for people who are a bit more inexperienced, or for people who want to use their flower during the daytime. So when I say balanced flower, what we mean is there's THC in there, and there's also usually either equal or close to the same amount of percentages of CBD in there, whereas a lot of unbalanced flowers, let's say, just have a percentage of THC in there with minimal amounts of CBD. And there are advantages to each. I would say that the balanced, like I said, is better for patients who are more naive, and also for patients who want to have, some of the benefits of the medication during the day, but without the sedation, and they want to be able to function, etc. So there are definite benefits to it. And I think there are definitely benefits to CBD for people who have inflammatory disorders, and a lot of pain particularly is inflammatory in nature, or has an inflammatory component to it. And there are theories about things like depression and anxiety as well, that they are also inflammatory processes. So I think the CBD can be really, really helpful to kind of manage both pain but also mental health. So I think it's well worth considering. And then the final formulations, not so many of these to choose from, but there are pre-filled vape devices. So these look very, very similar to these nicotine vapes that you see people using on the streets. They look like pens, or self-contained devices, and they already have a percentage of THC and CBD in them, with or without the other active compounds. So some of them are just purely isolates of THC and CBD in various concentrations, and some of them say that they're what we call full spectrum, so they have the other compounds in there that are thought to be beneficial. But there aren't many on the market. I think they're useful for patients who don't use very much cannabis in general, and they can last 2 or 3 months, so they're a little bit more expensive as an outlay, but when you don't use very often, they're very convenient, and they do last quite a long time, sometimes 3 months or so. And obviously they're much more convenient and that kind of thing. They don't smell as much as the flower. There's still some smell to them, but not as much as the flower. And again, I guess the concentrations of them has dependent on a couple of things, how much you inhale, how deeply, your lung capacity. So there's still some more variation, but you're much more likely to get, especially there are ones like the Noidex vape, which has a cutoff. So you inhale and it cuts off at a certain point. So it much more controlled, inhaled dosage, whereas some of the other ones is much more dependent on how you inhale. And then finally, there are pastilles, so like gummies that have THC and CBD in them. I would say that they're not useful for people who are new to cannabis or sensitive to it, simply because the starting dose of the gummies is quite high. So it's about, usually starts around 10 milligrams per pastille, something like that. And so you wouldn't be able to prescribe that for somebody who was like new to cannabis, because you don't know how it's going to affect them. It's likely to affect them um, in quite an extreme way. So if somebody wants to use the gummies eventually, it's much better to start with the oil, build up their dosage to the same level as the gummy, and then you can convert the gummy into, convert the oil into the gummy, and then that's much more safer for the patient. So those are the main formulations. And we also have CBD flowers, so flowers with no THC in them. I love these. I think they're fantastic. I think especially for things like inflammation, anxiety, these kinds of disorders, really, really useful. And they're also useful. Sometimes patients, we combine the THC based flower and the CBD based flower because we've found a strain that really works for them, but it's a little bit too much. So we can combine it with the CBD, and it just balances it out. Similarly with the CBD oils as well. Obviously, they're pharmaceutical grade, so there are advantages to having pharmaceutical grade CBD. But I would say to patients, if you want to try CBD, it's not necessary to have a pharmaceutical grade one. So it will obviously be more expensive than the ones that you can buy, let's say in Boots or whatever. But those formulations on in the retail sector, they're not bad. They still have to undergo certain examination, because they're considered a food supplement. So there's still, hoops, if you like, that they have to jump through in order to become a food supplement. But obviously the standards are not the same as when it's like pharmaceutical grade. But in terms of cost, the cost can be quite different. So I'd say if people are thinking about CBD, you might want to try something from the retail sector first. But just know that CBD is something that you need to try on a daily basis for like at least 4 to 6 weeks. It's not as instantaneous as THC, and you don't necessarily feel you don't feel anything like psychoactively like you do with THC. You don't feel high as such. I feel like you really notice what CBD is doing when you've been taking it for a while and then you stop taking it. And that's when people really like, oh, actually, I feel a bit unsettled. I feel a bit like wobbly with my anxiety, or my pain is hitting a bit differently to when it was. So it's like, once you stop it, that's when you really, really notice what it's doing. It can be quite subtle, but some people are very sensitive to CBD. Like they take some and it just knocks them out, makes them really, really sleepy. I really wish I was one of those people, but but yeah, some people are super sensitive to it. So don't just assume that because it's non-psychoactive, because you're getting it in Boots, it's not going to have like much of an effect on you. It can be really, really sedative.
Yeah, amazing. So I just have, I guess, a couple of questions in terms. I suppose I'm just trying to figure out which one to go with first because they're both kind of interlinked with each other. So it's about, I guess, would you be able to talk us through the cannabinoid system and how that, I suppose, supports medical cannabis as a medication that sort of tackles a variety of different categories? Because I think that's one of the things that I find very, very fascinated about because I cannot believe how it can just tackle so many different things. Like for myself, I mainly use it for chronic pain, but I've also got ADHD, and I tend to find that even though I'm taking it for chronic pain, it also helps with my ADHD. So I think I phrased it like that. Yeah.
Yeah, yeah. But that's really, really common. So, the amount of patients that I have where their primary indication is mental health. So, in terms of my ability to prescribe for them, their primary issue has to be mental health. Like, I'm not allowed to prescribe for somebody whose primary condition is, let's say, arthritis, because I'm not I'm not a rheumatologist, for example, and that's That's around the regulations at the moment. But the amount of patients that I have where the primary disorder, let's say, is anxiety, but the secondary disorder is some sort of chronic pain for whatever the cause is. And it's so common to find that you target the anxiety, but their chronic pain is also managed as well. And that's very likely to be because of essentially the extent of the endocannabinoid system. It is basically all over your body. There's pretty much not an organ system that doesn't have these cannabinoid receptors on there. So they're on your heart, they're on your gut, they're in your ovaries, they're in your brain, like they're everywhere. Fortunately, they're not in your brain stem, so you don't get respiratory depression like with opiates. So opiates, one of the biggest risk factors is that it has receptors in your brainstem. Your brainstem controls your kind of like functions that keep you alive, like breathing, for example. So when you take too much opiates, it depresses your brainstem and it suppresses your breathing, and that's why people overdose and that's why they die. Medical cannabis endocannabinoid receptors are not present in the brainstem, which is why it doesn't cause that kind of respiratory depression, which is why it's relatively safer as a pain control medication versus opiates. But there are endocannabinoid receptors everywhere, and that's probably why you can have this scenario where I can treat my mental health, but I can also treat my pain. Now, what endocannabinoid is thought to do, and again, we're still working this out. So, a lot of brain function and your nervous system function is a delicate balance of on switches and off switches. So, um, hormones, for example, that turn things on, or neurotransmitters that turn things on, and neurotransmitters that turn things off. And essentially, most of your nervous system is your nerves connecting to each other. So there'll be a nerve signal that will travel in this direction. It will reach this node or endpoint. It will trigger a response, and then chemicals will travel across a gap to the other nerve, and then that sort of chemical will attach and trigger another signal, and then the signal will carry on to the next junction. Now, neurotransmitters, like I said, they act like on and off. So it can turn it on, but it can also turn it off. Now, what endocannabinoid is thought to do is when a signal comes along, it's like released and it can travel back and forth. And essentially, it regulates the on and off. So what it's thought is say, for example, something like anxiety, that there is a particular neurotransmitter that is just switched on, and it's just on and firing, and it's just on and it just doesn't stop and causes your anxiety, your restlessness, your agitation. And then the endocannabinoid is thought to come along and just say, calm down, turn off, like. And equally, if it's not turned on, so if we think about depression and neurotransmitters involved with depression, we can argue that there's not enough of these neurotransmitters. So if the switch is off, endocannabinoid comes along and says, you need to switch on. And it's that kind of regulation of the on and off switches which is thought to have a lot of the effects of endocannabinoid.
Oh, thank you so much. Sorry, I think you can hear I've got a bit of a cold over here. But thank you so much for going over everything with us and for joining us here today. I think people would really appreciate this level of insight and information. And for anyone that is interested in getting more of an understanding of what are the different conditions that medical cannabis treat, it is on the website. Thank you again for joining us, everyone. Thank you, Louisa. And I look forward to seeing you next week where we're going to talk about some patient experience. Thanks.
Thank you.
One, thank you, Louisa, and I look forward to seeing you next week where we're going to talk about some patient experience. Thanks.